Let's shift our attention to some other stories now. And about 5.3 million children under the age of 5 will be immunized against measles, rubella in an upcoming mass vaccination campaign scheduled from the 2nd to the 6th of October, following an outbreak of the disease in all districts of the country. These children include more than 600,000 who have been since the last mop-up exercise in 2018, and we are told that there are also going to be first and second doses of the vaccine given to these children.
Measles is a highly contagious disease that spreads through fluids from an infected person. Vaccination is the most effective way to prevent the spread. Although the coverage of measles-rubella vaccination is quite high in the country, the inability of the government to achieve 100% coverage has resulted in some children under 5 missing out during routine immunizations each year. In addition to these missed cohorts, some children who received their first doses at 9 months have defaulted on receiving their second doses, which provide the maximum protection against the disease. And healthcare workers are not oblivious to the dangers.
Friday, we have a mother around who was just scared because she saw some rashes, so she has a little knowledge about it. She was thinking it could be measles, so she came to us. But this same mother has been given a date to come for child welfare clinic a month before. She didn't come. Even we have the measles that takes place in the first 9 months. Then it's repeated at the 1.5 year, that's the 18 months. But can you know what's happening now? Mothers will take the first one, and then when it gets to the 18 months, you will not see them.
Cases of measles are already being reported in all districts across the country, raising concerns. However, mothers who play a critical role in ensuring their babies receive vaccinations are failing in this regard. Mary Yiga, a mother of almost 9-month-old Antonio, says her son would be due for measles vaccination on Tuesday and she would not miss it for anything.
I always check inside the book a week before, so I don't miss any of his appointments.
Next week, Tuesday, in 9 months.
According to the program manager of the expanded program on immunization at the Ghana Health Service, Dr. Kwame Amponsa Achiano, they had anticipated the situation and are planning an upcoming campaign to address these gaps.
We predicted that, but there were some bottlenecks, but now we've circumvented them and we have secured vaccines from with support from Gavi. And so our next campaign comes off in October. So some of the outbreaks will come, they burn out, others will come and so on. But the bottom line is that we have several districts that have reported cases, whether confirmed or unconfirmed. And as I said earlier, this is not something we didn't predict. We could see that, and then we were planning for children. We look at the data and see which age groups are getting the outbreaks, and then we mop up. So what we are going to do, we're going to target about 5.3 million children who are under 5, because it's under 5 that is hardest hit.
It's been 6 years since the last mop-up exercise in the country, and these cohorts of children 5 years and below till 9 months, like little Antonio here, need to be reached out at all costs. Make the children available and let's promote their good health and break the measles outbreak chain. It's better late than never. Sarah Apenkru, TV3 News, Lekma Polyclinic, Accra.